So we're still talking about therapy. One very uncommon therapy that's used when severe depression is something called electroconvulsive shock therapy, and that's exactly what it sounds like. You get an electric shock, and this reduces the symptoms of depression for people with severe depression where nothing else has worked. It's uncommon. They don't know exactly why it works. It does cause some people to experience seizures, which alleviates their symptoms of depression. I'm sure if you watched TV, you might have saw something called free association or psychoanalytic therapy or psychoanalysis, and this is where you sit on someone's sofa and you say a word, chicken, then they say the first word that comes to their mind. And then you use this information to understand their unconscious processing, which is what we talked about a couple of sections ago. There are also several different kinds of drugs that people take to deal with their symptoms. We're going to talk about a couple: antipsychotic and anti-anxiety. Antipsychotic is usually used to help people deal with hallucinations, help people deal with hearing auditory sounds, auditory and visual, or paranoia. Anti-anxiety obviously helps with anxiety, and it does so by depressing the central nervous system so that you feel calm. So let's talk about the different types of therapy and how they might benefit you. So group therapy is when you go to therapy in the form of a group and many of the people in the group experience the same problems or have similar problems as you do. Another form of group therapy is going to be like structural family therapy. So this is where you talk about the family dynamics and how you can improve them and how everyone's roles can become more clear so that you can experience less distress and more success. There are also certain types of group therapy which are recommended for addiction. Addiction is considered chronic, which means even if you are not actively taking a particular substance, that addiction is something that you have to deal with for the rest of your life. It's very difficult to beat. 40 to 60% of people often relapse, and it takes at least 3 months for you to see the benefit of treatment when you enroll in treatment. Lastly, I want you to review cultural competence. That means how much the therapist understands the culture of the person that they are working with, and that changes by region and by location. And then I want you to look at some of the issues with cultural competence that are covered in your book. So cognitive behavioral therapy can be really effective in treating things like anxiety and other very specific situations. So I want you to review how it can be effective and exactly how it is used. That's going to be one of your short answer questions. Then I want you to go over some of the barriers to receiving mental health services. So what are things that stand in the way of people being able to access mental health? Those things could be systematic barriers like affordability or cost, or those things could be cultural or social barriers, like the way that they will be perceived.